Hello and welcome back to Brussels. Now we're going to have each one of the discussant leads to give us the highlights of their discussion. And I'm going to start by asking Pascal.
Thanks, Ole. I would like to pick up a few elements in the discussion. The first one, most important, was coming and also accepted by the others, was coming from Miral, was the need for meaningful patient involvement. We moved on later to consumer, family, and citizens in terms of information, but clearly meaningful patient involvement was a key message. Then an important part of the meeting was also around good practices. We tried to ask the speakers about good practices, mostly on screening and management. And we've got good practices. And earlier reminded us that the European Nutrition for Health Alliance was the key center for collecting and producing events with the ONCA campaign to share those good practices. So in a nutshell, that was it. Unfortunately, because Marta Balaz had left, we couldn't tackle so much. One issue he mentioned, which was the coherence between policies and in particular EU policies, but that will certainly be for another session.
Thank you, Pascal. Now we're moving to Madrid, and I'd like to ask Christina, give us the highlights of what your discussion has been all about. Over to Madrid.
Thank you, Ole. Well, I think in the session on COVID, we stress the importance of nutrition, both in the general population and also in the patients regarding this COVID pandemic. Nutrition is very important to maintain the immune status of the patient and of the general population. So general population should eat healthy food and maintain healthy lifestyles. And when we go down to patients, we know that patients with COVID are at high risk of malnutrition because sometimes the disease is very severe and have a lot of gastrointestinal and influence also on the smell. So it is important that we address this malnutrition, we screen malnutrition, diagnose malnutrition, and treat very early this malnutrition in our patients to avoid this loss of weight, loss of muscle mass, that will increase, of course, an impairment in the function of these patients, and it will take longer the recovery of the patient.
Thank you. Thank you very much, Christina. Okay, the last group for the breakout was in Amsterdam. So, Bert, I'd like you to give the highlights from that breakout, please. Over to Amsterdam.
Thank you, Ole. First of all, I would also like to thank the audience, not only the audience, of course, who attended our workshop, but also in general the audience. The statement was cancer is a chronic disease. More than 1.3 million people die from cancer each year. And again, malnutrition is very, very important. First of all, we are very glad to hear that the EU Beating Cancer Plan resonates very well among different stakeholders. And when I use the word stakeholders, it's a multidisciplinary team. It's a multidisciplinary approach, which basically it starts with, let's say, the bottom is then medical students. So we discussed the fact that it's not in the current curriculum of medical student, the word nutrition or malnutrition. So this should change, and we had a lively discussion and a lot of questions on this topic. And maybe during the next session, Professor Muscaritoli and others can elaborate on this. Another group of stakeholders, of course, let's not forget, are the patients and also the cancer survivors. Different patient advocacy groups among Europe do a lot of efforts basically to put malnutrition and nutrition on the agenda of their local politicians, which is of course good, and work on educational programs. Last but not least, of course, the treating physicians, when we see that only 50% of patients who are diagnosed with cancer also basically get information about their nutritional status. Of course, there is a lot of things to do. And so again, we focused on education. Closing remark from our side will be, let's continue this discussion with all stakeholders to sustain this momentum to accelerate our key collaboration. It's nice in wording, but I think it gives the focus of this session, how important these sessions are with these excellent presenters and with you all attending this webinar. Thank you very much.
Thank you, Bert. Very, very interesting indeed. I think we've heard 3 very interesting sessions, and I'm sure we're all going to be checking out what the others were saying in full. So with that, I'd like to hand over to my good friend and co-chairman, Regina, over in Austria.
Thank you very much, Ole, for handing over, and thanks all the colleagues for the very, very comprehensive preparation for this incoming session on education. It's my great pleasure now to introduce you a bit into the topic and then have outstanding experts who will give us short pitches in from the scientific societies on what their experience and programs on implementing nutrition, especially in education, are. As you can see from this slide, if we're talking about education, and I think many groups have highlighted the importance of education and training of professionals to reach implementation in the member states in the European Union, we should consider a comprehensive framework where education and training and skills development is embedded. Please have a look at the 3 circles to the bottom of this slide, which shows you that the population you're studying or the population you're targeting is in the very center. So whenever we are talking about nutrition, we're talking about a very personalized approach. And everything that needs to be developed by professionalists, meaning the health workforce, has to have a strong focus on population needs to encourage health promotion and also disease prevention for this population they are working with. You can see I'm talking about population and citizens. I'm not talking about patients, to highlight the input of the preventive approach in all levels of prevention. And if we go for health workforce development, then there are 2 topics have come up in all the groups in the discussions. One of this was, how do we achieve integration of nutrition in a care plan, but also integration of care plans over all care settings patients are living in, and how do we achieve the multidisciplinary team approach? And let me highlight that seen from the point of an educator, the multidisciplinarity is of lower priority. Rather, we prefer to say it an interprofessional collaborative practice on a very, very low hierarchic structure, including everybody coming from different national qualification frameworks to be part of this team. But if we talk about health workforce development, we also have to consider that those health workforces working under circumstances in a healthcare service. So what those people need to be skilled and have to be trained for is to use new digital solutions and technologies, which has probably also come up during the COVID crisis, that ICT-based support also for nutrition may be an opportunity to reach out for people living in community and to follow up for those who come from hospital. And last but not least, of course, including people, citizens and patients in the care systems, encouraging self-care and also the self-management capabilities of a population is of utmost importance when we talk about skilled workforce development. Within the European Union, we have certain policy instruments and instruments we can work on and build on for the future, also if we join the health policy platform. And one I would like to introduce to you is the Horizon Scanning Instrument. The Horizon Scanning Instrument has been developed under the umbrella of the European Commission by joint action. And it assists policymakers and practitioners who plan for care systems to get a collective understanding of the dynamics around healthcare workforce and what is needed from healthcare workforce to cover an interprofessional collaborative practice, but also to be prepared in terms of content that needs to be translated to citizens, to patients, and to move around in healthcare systems. The 3 topics covered by this Horizon Scanning Instrument to develop education and training and health workforce within healthcare systems are shown in these slides. As you can see, we have a projection on population, so we may estimate the needs of the population, and we can encourage population to participate in preventive and curative approaches, including nutrition, in any disease management we are offering. Then we have the healthcare services. You can see ICD is an important issue to be included, especially when we think of location of care by setting, and how can we connect different care settings to go beyond. And last but not least, it's the health workforce. And to be honest, the health workforce in Europe is an aging one. So we have to look after the people who are working in healthcare and look after them and adopt them with competencies that enables them to embrace a multi-professional or an interprofessional approach, to give them a skill mix to include it. And as we've heard from the students, and this is completely in line with a recent publication coming from our university, nutrition is not at all included in the European curricula, at least for the medical doctors at this time point. So there's a long way to go for us as the European Nutrition and Health Alliance. And last but not least, we have to make sure that our health workforce is able to move around within the European Union to give them the health workforce mobility as foreseen by the European Commission. So to sum up, I would highlight with the picture you can see here, you have the skill mix needed, and we should put a special focus on the content we need for different settings, working with citizens and patients in terms of prevention and care. We need to equip this healthcare workforce with the capacity to move within healthcare systems that are modern, flexible, and equipped for the future. And I'm especially referring to the ICD skills that are needed from this health workforce. But we also need to equip health workforce to work with the people. And somebody highlighted today that finally things are done on the ground. I think it was Madrid mentioning this. And if we talk about education and training, we equip the people to translate decisions that are taken in Brussels, finally within the member states for the sake of the people living within in EU member states. Having said so, I think it's important to notice that now we will have the pitches from our dear guests and partners and experts from the different societies who will highlight within this framework what they are doing. And it's my great pleasure now to introduce Professor Cornel Sieber. Professor Cornel Sieber is the former co-chair of the European Nutrition and Health Alliance and helped to build ENHA to what it is nowadays. He is currently the medical director of a huge hospital in Switzerland, and he's also the president-elect of the new European Geriatric Medicine Society. I would now like to hand over to Professor Sieber, and he is going to guide us through the next presentations. Thank you.
Thank you very much, Regina, for the nice introduction. First of all, I would like to welcome you all contributing and being here with us in this virtual conference on, as you have already heard, it's a very important topic. Nutrition is key to life. And I think by that, everybody thinks somehow he's an expert or a specialist. And that may be also one of the challenges. So how we can boost awareness that nutrition has to be seen in a targeted and individualized way. And for that, education is key, and I'm therefore proud to be somehow a little bit helping here within this session. Repetitio est mater studiorum. Repetition is the mother of students, and I think even if it comes to education, we have to look for a lifelong learning, because also the task and the challenges for nutrition also may change over life. I have now the pleasure to introduce three speakers who all will give a short presentation what they think is key in education. And I would like to start first with Professor Maurizio Muscaritoli from Sapienza Università di Roma. Maurizio, it's very nice to see you here.
Thank you, Cornel. Good morning, everybody. I'm very happy to join this beautiful event. As it was said, nutrition education is extremely important. And still in medical schools, nutrition education is very scarcely implemented. I am here today to represent ESPEN, the European Society of Clinical Nutrition and Metabolism. And I would also like to say that that ESPEN has a very powerful educational system, which is represented by the lifelong learning program, the LLL program, which covers for postgraduate people over 40 topics and 120 modules. This is a very powerful educational program ESPEN has, which has already educated some almost 100,000 people. But ESPEN is very much involved in education. In 2017, the Nutrition Education Study Group of ESPEN launched an initiative which is called NEMS, Nutrition Education in Medical School. And this is a very important project I have the privilege to share with Cristina Cuerda in Madrid. With this project has already reached some targets. For example, we have published a paper where we have identified within the 3 areas of human nutrition, which is a very complex issue. We have identified the areas, and within these areas of human nutrition, we have identified the 5 main learning objectives and the 21 topics on human nutrition, which should be known and should be delivered to medical students. Recently, in January 2020, we had, before the epidemics and the pandemic, we had a meeting in Nice of this group, which was attended by 51 delegates from 34 countries and 13 European university representatives. And in this occasion, we signed a manifesto where we have declared the reasons and the ways we would like to implement nutrition education in medical schools. So this is one main topic of interest for ESPEN. And as you mentioned, Cornel, ESPEN recently joined and entered in contact with this initiative promoted by European Commission, which is the Promoting Lifestyle Medicine Initiative, which is very much based on education of healthcare professionals. So we do think that with this collaboration, we, ESPEN, could provide this initiative with knowledge and experience, which might be very fruitful for promoting lifestyle medicine and nutritional education for healthcare professionals.
Thank you very much, Maurizio. I would like just to add that, you know, LLL has been really a success story in the past and has developed over time. And just with the say, because of lifelong learning, it has first been started to be for more professional. Now it goes also to pre-grad and so on. And even ESPEN is a European society. And today we have this nice possibility for this conference on an EU level. It has been so successful that this has become also a global campaign. So I think this is a very good example to show how over time things can develop in an organic, good way for the important issue about education. So thank you very much, Maurizio, for your statement.
My great pleasure.
Now I have the pleasure to introduce Marian de van der Schueren. She is also a good colleague. She's also active within ESPEN, but also within the European Union Genetic Medicine Society. She is a professor of nutrition and health at the University of Applied Science in Nijmegen.
Well, good morning to you all. Thank you for the introduction. My name is Marian van der Schueren. I have a role as a professor of nutrition and health, but also a role as a professor of dietetics at Wageningen University. I have worked as a clinical dietitian for more than 25 years. And now I have moved into science and education. And today it's my pleasure to talk about the important role of education for dietitians and by dietitians on behalf of the European Federation of Association of Dietitians. Imagine a patient hospitalized. He may have a COVID-19 episode, or he may suffer from cancer, and he has lost a critical amount of muscle mass. This impairs his recovery. He suffers from more side effects of treatment, and he may even live shorter than a patient who has not lost muscle mass. This patient is being treated by a multidisciplinary treatment team. In the treatment team is the medical doctor, the nurse, the physiotherapist, a pharmacist, and the dietitian, the clinical dietitian. Why is the clinical dietitian in the treatment team? She is aware of the latest scientific knowledge, and she is the person who can translate the scientific knowledge from the science to the patient, taking into account side effects of treatment, his mood, pain, and, for example, the tumor stage or the stage of disease. In addition, the dietitian has excellent counseling skills. So she uses cognitive behavioral techniques or motivational interviewing techniques to empower the patient to follow up the dietary advice. So she starts with making a nutritional diagnosis. She translates this into a dietary advice. She counsels and motivates the patients, and she empowers the patient to be self-responsible for following up on his diet. Of course, she regularly follows up with the patient and adjusts where necessary and according to the disease state and the treatment. This dietitian has a role in education. She educates, for example, medical doctors, nurses, and other healthcare professionals. This is important because we all know, and this is emphasized nowadays, that nutrition and other lifestyle factors are very important in the prevention and treatment of many medical diseases. In contrast, please click, you can see that within the medical curriculum, less than 4% of time is spent on lifestyle issues. And within the nursing curriculum, this is even less than 0.5%. So there's a clear call to action to give more nutrition education within the different curricula of healthcare professionals. I have shown you the ideal picture of a dietitian in a multidisciplinary team being responsible for education of other healthcare disciplines. But we know that the situation is different within different countries. I myself am very happy to be able to fulfill a scientific role and to have a professorship in dietetics. In other countries, and we have heard this before, the dietitian is part in the multidisciplinary team, maybe in less than 5% of hospitals, like in Germany, as said by Nicole Erickson before. Or she works in the kitchen and does not even have a bachelor or does not even have a bachelor degree. Therefore, our call for action is to align the dietetic education across Europe, meaning that in all countries in Europe, the dietitian is known for a high quality, for her high quality standard and has at least a bachelor or a master's degree. She combines science and practice, is aware of the latest scientific insights, and she also continuously researches the results of the dietetic intervention. She studies how she can implement new techniques like e-health or blended care. And she is responsible for an increasing amount of education on the importance of nutrition for all healthcare professionals. The dietitian is known for her critical, curious, and innovative attitude. If we manage to To reach this, we will guarantee optimal nutritional care for all, because well-educated dietitians bring their knowledge to both patients and other healthcare professionals. With this last word, I would like to give back to Cornel.
Thank you very much for this very clear statement, Marian, and also putting out the importance of the interdisciplinary team and the very important role of dietitians in this role, and also showing that we have to educate people in this profession to have also the possibility to have them within the teams, and the problem that in many services, countries, we lack this speciality helping for the big challenge with nutritional problems we see both in hospital but also in the outpatient setting. So I have now the pleasure to introduce the third speaker. It's Rana Orhan. Rana Orhan holds a double degree in European Public Health, both from Sheffield and Maastricht. She has been an important member of EMSA for many years, and her important position at the moment that we can start nutrition education at the pre-grad level is that at the moment she's the Public Health Director of the European Medical Student Association. So welcome also to us and for your presentation.
Yes, many thanks. I'm happy to be here since the beginning to represent students' voice in this. First of all, when I say students, I don't only mean medical students. You've heard dietitians, you've heard nurses, and other disciplines talk today. So when I say students, I hope I can represent all of them in that case. About the European Medical Students Association, though, we represent medical students across Europe, and we're committed to ensuring the highest standards of healthcare and medical education in a united Europe. And we do this, or we hope to ensure this by empowering medical students in advocate health in all policies, excellence in medical research, interprofessional healthcare education, and the protection of human rights across Europe. So let me first start with a fact that was quite unknown for me. And I have a bachelor's degree in medicine as well, so I did some preclinical years. So that's the period that I should have got this info. But I learned recently that up to 1/3 of cancer cases is preventable by adherence to a healthy diet, maintaining a healthy weight, and regular physical activity. This is nothing new. It's from 2007, this knowledge, and I was quite shocked to only learn this, well, let me say yesterday even. And I can assure you that most medical students and most healthcare students don't know about this. And yet, we can say good nutrition is a cornerstone of good health. It prevents diseases, that's one thing that we want, but it also ensures or makes sure that there's a high or higher quality of life when you are a patient. So what we believe is that there's a role in education. I will talk about that in a bit, but there's also a role for policymakers. And I told you about health in all policies. So this is obviously an issue that doesn't only go to the Ministry of Health, but should be something that also goes to trade or whatever other ministry. Because we believe that growing up in an environment that stimulates healthy diet is a fundamental right of every young person. And this is not something that you can only achieve from a medical perspective or even from the Ministry of Health perspective, let me say. So back to us as future doctors. What's relevant for us? Well, the scope and the needs of medicine have drastically changed over the past century. It's not enough, but there is an increasing emphasis on disease prevention and on healthy lifestyle, which we've heard a lot about today. We believe medical schools should work towards changing their curricula to meet society's needs. So medical practice, along with other healthcare disciplines, should consider shifting its focus toward promoting health and well-being and the prevention of disease. If nutrition and health education is taught throughout a medical student's career, the physicians of tomorrow will be more mindful and capable of influencing or helping their patient in achieving or maintaining a healthy lifestyle. And you would also ensure that physicians are proactive in this. So we believe students need to be trained. They should be equipped with the skills to be able to provide nutrition counseling to patients. And this education should start at an early stage in the education. So from the first year on, you have to learn about nutrition and its link to diseases and disease prevention. Well, unfortunately, and this has been told by the former speaker, is that in Europe, learning about nutrition is, what was it, 4%, 5%?
Less than 4%. Yeah.
Less than 4%, a shocking percentage. And it's mostly, when it happens, it's at the discretion of the medical school, maybe a national government, and other civil societies, as we've heard before. So what we need is that nutrition and nutritional care are included in European core competencies of future doctors and future other healthcare professionals. And it should be taught in the preclinical or early years, as I said, since this will change the mindset of students and make sure that they're basically brainwashed with the idea that nutrition is important in every way of medicine. Making it a core competency would give nutrition the place it deserves in the education. To conclude, there's a lot happening. We talked about the European Beating Cancer Plan. It's an amazing plan. I'm very happy it's coming. There's another plan, the Farm to Fork strategy. It also touches upon food and nutrition. And there's, of course, the Green Deal, which is a whole package and even talks about the European Competence Framework. What I'm saying, or what I want to say, is that we're not hearing about any of these at medical school. I'm not arguing that all of these policies should be taught during lectures, because not everything is that important and there are other priorities, I get that. But if there's an expectation of healthcare professionals, we as future healthcare professionals need to know this. We need to be prepared and we need to know what the future responsibilities are that we need to take to serve society. If there's no clear answer for this, well, let us think along. We're here, there are many students' associations, we're here for the medical students, and we're ready with our ideas to share with you as policymakers. Thank you.
Rana, Orhan, thank you also very much putting the importance, and as you have said, in the medical curricula at the university, nutrition is really by far not at the percentage level of hours we have during the whole medical curriculum when nutrition is taught, and also at the bedside, I have to say, not just on a theoretical element. You alluded to that.
And if you agree, Cornel, I would now give a short wrap up if you agree. First of all, I want to thank all the participants for their marvelous contributions. I think it was able to draw a nice bow coming from European politics, including everybody who does work on the ground. And we had really brilliant reports on what is going on. And I think we heard the word regulation coming from politics. And I heard and listened very carefully somebody saying we need a strategy. So we need a European strategy and a platform to meet. ENHA has prepared the grounds already, collecting the best practice models via their program ONCA, Optimal Nutritional Care for All in the member states. But of course, this is just the kickoff, and the program needs to be included and needs to be integrated in the European politics to achieve health and nutrition in all policies, as Rana said in a very nice way. I think we're now at the point where we need to get to action. We need to get to action for a broad screening program across the member states, followed by diagnoses and tailored action. And people and citizens and patients have to be in the center of what we are doing as healthcare professionals. And we need to be equipped with skills and the attitudes to work collaboratively in interprofessional teams. This is what we have heard from different partners participating in this live event today. I think we need to be prepared, and we need to be prepared because it's 5 minutes past 12 already. And I think we are delighted to have a commitment of political decision makers today that we want to work together and bring the evidence we have created through over the past years in our communities and implement them in daily practice within our healthcare systems across Europe. Within these words, I would like to close now, and I hope this wrap-up covered what all the participants heard from the different sessions. We hope you enjoyed it. And it was foreseen that Mr. Tarabella would give a few closing remarks, but I would like to give back to our Brussels studio for the final close-up remarks to Ole Lundqvist. Thank you for your attention.
Well, thank you, Regina, back in Brussels. I'd like to start off by also thanking all the participants, the politicians, MEPs in the European Parliament, people in the Commission, and of course, people also working in government, all very, very busy, but also the professionals and patients and everybody participating, not least all of you listening and taking part of the discussions. I think that what we've heard is that indeed everybody is seeing the need for nutritional care as part of the major EU plans moving forward in current times. And that involves cancer, the cancer movement that we're working on within the EU, but also the COVID-19, the current pressure that we're all under. We all see the need and have been expressed by everyone today of working together. So it's a multi-stakeholder platform that we're really embarking on. And everybody who takes healthcare seriously have joined me and Frank Deman in the statement that if you take health and healthcare serious, if you're serious about that, you should be serious about nutrition. So the challenge now is really to harbor and use all the momentum that we've seen today, the will and the drive to move this forward, because we do have a common goal. And that goal is to assure that we have optimal nutritional care for all in the EU. And with that, I close and I thank you for being with us today. Thank you.